And with a spike in coronavirus cases comes a spike in the need for travel nurses, and not just here in Arizona. We're talking all across the nation.
One travel nurse agency says there are 30,000 jobs right now, the most they've ever seen. Our Kim Powell joining us live tonight. Kim, where does Arizona fall in all of this?
Yeah, Aya Healthcare, the travel nurse agency, says that Arizona is actually in pretty good shape compared to the Midwest. There are about 500 nursing needs right now in our state, but what they're noticing is that hospitals here are planning ahead. They're planning for January.
We turned into a crisis staffing company literally over a weekend.
Sophia Morris is the vice president of account management at Aya Healthcare and works closely with hospitals to meet their needs for clinicians. Right before her eyes, she watched as the job numbers for nurses kept climbing and climbing.
We had a large client on the East Coast in New York that said we need 1,000 to 2,000 nurses to get here in the next month, and we had to find a way to deliver it.
The wave of COVID-19 went from the East Coast to the Midwest, and eventually needs for travel nurses dropped. Then we saw the first big spike in cases over the summer in Arizona. With that, a spike in nurse job openings.
We expected it to kind of come down, but it hasn't come down. It's just continued to be consistent and to climb.
Morris says more hospitals are requesting travel nurses now as they prepare for a spike in COVID-19 cases and the flu. Currently, there are more than 30,000 jobs available across the country, and hospitals are getting competitive.
Supply is absolutely constrained, which is definitely driving costs up for facilities because they're having to compete for a much tighter supply base, especially when they're needing clinicians to start in a very short amount of time.
Right now, there are 500 travel nursing jobs open in Arizona. Morris says that's about average for this time of year. In July, there were more than 1,000 openings.
Now the needs that we're seeing for the most part in Arizona are for later starts. So we just staffed a big lump of needs, for example, that start in January. And hospitals are just trying to get ahead of that.
Not only are hospitals offering more money for travel nurses now, they're also offering shorter contracts so they have more time to recuperate before moving on to their next gig. Reporting live in Phoenix tonight, I'm Kim Powell for Arizona's Family.